Hi, this is Dr. Siegmund with Core Chiropractic, and I'm here to answer a question that a lot of my patients come up with each and every week. And they hear it from a lot of friends, even a lot of medical doctors and other practitioners use this term, and it can a disc split. And so the discs are essentially situated between the bones in the back. So the disc itself is meant as a stabilizer for the spine. So it can turn, it can twist in different positions, but it can only go so far before it'll actually start to fold. It can also protrude. You can have what's called a disc herniation, and sometimes you can have what they call a sequestration, where the disc will actually tear and then it breaks off and it falls down spinal canal. So when people say the disc slip, they don't really slip. It's necessarily where there's a subluxation in the spine where two of the bones move in opposite positions, or they rotate into a position to where the disc is compromised, and the disc itself will start to bulge or protrude, but the disc doesn't actually slip or slide out. It'll squeeze and it'll push out, but not necessarily where it slips. And it's usually caused by either small traumas over time, what we call micro traumas, whether sitting at a desk, bad posture, but can also be created from car accidents, slips, falls, things like that. But whenever somebody says they have a slip disc, it's not actually the disc itself that's slipping or sliding out. It's really where there's essentially a misalignment spine that's causing that disc to either push out, but not necessarily where it's slipping. It's staying intact. It's just moving out of the normal spot that it usually sits, and it's starting to touch on that nerve. And so that's why you see a chiropractor. If there's an issue where you think that you possibly have a slip disc, or you know somebody that does, they do respond really well to conservative treatment. If it's in within the parameters of what we typically treat. But it's something that we do see very often. It's a very common question. It's not a bad one. It's just that discs don't slip. They can bulge, protrude, herniate. But it's something that we as chiropractors take care of all the time. So if anybody that might suffer from slip disc, make sure they follow Core Chiropractic. Send the information for us. We're more than happy to get them examined, x-rayed, and then possibly treated. If it falls within something that we take care of. And look forward to helping them out. All right. Appreciate you guys. Have a great day.